Hi, I'm Dr. Alex Lopian, and I'm speaking from Mott Children's Hospital at University of Michigan. I'll be talking today about slipped capital femoral epiphysis, or SCFE. SCFE is a common cause of hip pain and limping in growing kids and adolescents. Kids' bones, such as the thigh bone and shin bone seen here, grow through areas called growth plates. These are primarily made up of cartilage and are more rubbery and softer than the rest of the bone. While a child is growing, we refer to these growth plates as open. However, once fully mature, these plates become closed. The growth plate at the top of the femur, or hip bone, sees a lot of stress from supporting the whole body. Due to this high stress, in addition to the growth plate being softer than the adjacent bone, this particular growth plate can slip out of position. We think of this similarly to an ice cream scoop falling off the cone, because that is how it can appear on an x-ray. This can lead to pain and stiffness in the hip, and can cause a limp or make it difficult to stand, even when using crutches. There are two major kinds of SCFE, stable and unstable. Stable SCFE is more common, and the symptoms might be milder. Kids with stable SCFE can often put some weight on their affected leg or walk around with crutches. They may have had pain for several weeks before coming to the doctor. Unstable SCFE is less common, and kids with this condition often cannot walk even with crutches because of the pain. As a result, kids with unstable SCFE often come to the emergency room immediately. Unstable SCFEs can damage the blood supply of the hip, so they typically require surgery immediately. Adolescents will commonly present with pain in the groin or hip that worsens with movement. Occasionally, this pain will be more prominent at the knee or thigh. It is common for this pain to cause a limp and to force kids to prefer sitting with the affected leg crossed over the other one. Your doctor will evaluate your hips and move them gently to see if they are stiff or painful. They will also ask where you feel the pain the most. If SCFE is suspected, x-rays will be taken of both hips because sometimes both hips can be affected. There are several risk factors that make it more likely to develop a SCFE. These include obesity, thyroid issues, radiation treatment, and kidney disease. The most likely age of a patient to develop a SCFE is between 10 and 16 years old. Because the ice cream is slipping off the cone, the treatment is to stabilize this area. The way we usually do that is by holding both pieces of the thigh bone in place with one or two screws. Moving the pieces back together can damage the blood flow to the ball of the hip, so we hold the pieces where they are instead of moving them back into their natural position. Your doctor might recommend placing a screw into the other hip as well, either because you are very young, which makes it more likely that the other side can slip in the future, or because you have other risk factors that might also cause it to slip. Rarely, the slip is so severe that a bigger surgery is recommended to realign the hip bones before stabilizing them. In these cases, your surgeon might plan an operation called a surgical hip dislocation or a modified Dunn procedure. Once fully healed after SCFE, adolescents usually return to all activities. There is, however, risk for hip pain or stiffness into adulthood, even with the appropriate treatment. The earlier it is diagnosed and the less severe, the better the patient will feel once it has healed. Both hips will need to be observed over time, at least until the growth plates on both sides are closed, and in some cases, a second procedure will be required to help reshape the hip. Thank you for listening.